and I do some horse work on my days off. So, what sciences do we use in veterinary medicine? Now, I know you guys had a presentation by a medical doctor, and my guess is she talked very similarly about various sciences she uses, and we use basically the same ones, we're just using them on animals. So, biology, that branch of science, the big ones that we use in there would be anatomy, right? So anatomy is muscles, bones, nerves, everything like that on the animals, and you learn that primarily by dissection. Okay, and that's one of the first classes that we have in veterinary school. And it's a huge, important part of our practice because our animals can't tell us what's wrong, right? So if you go to the doctor, you say, oh, I hurt my knee, this is what's feeling sore. Our animals can't do that. So we have to see by observing and by feeling and looking at the normal anatomy and saying, this part's abnormal. And that's how we can help figure out what's wrong with our pets. Microbiology, so that's the study of microorganisms, right? So that includes viruses, fungi, so ringworm, that's a big one that we deal with a lot in veterinary medicine. And then of course bacteria, okay? And then physiology, which is basically the study of the natural processes of the body. So how nerves function, how they fire, how the circulatory system works, right? Kind of the basics of the body and how it lives and how it continues to function. And probably you guys, I'm sure, have already started learning some of those basics as well. And then chemistry, some people really like it, some people don't. But believe it or not, that is part of what we use as well. Biology is definitely our main focus, if you will. But chemistry is very important because chemistry plus biology gives us biochemistry, and that tells us how the body makes energy, so ATP, and it also tells us how the different hormones work, all the different cycles in the body that are important to keep it functioning. And then pharmacology. So just like human doctors, we use medications in order to help our animals. And we need to be able to know how those medications are made, what they're composed of, as well as the effects they have on the body, the effects they have with each other if we're using multiple drugs, and also any adverse effects they can have so that we can warn the owners and be prepared and know what to test for to keep track of how the animal's handling the medication. And then believe it or not, we even use physics. I'll be honest, physics wasn't one of my favorite subjects, but it is important. Think about the fact that one of the things we do in veterinary medicine, just like human medicine, is we take x-rays. It's one of our diagnostic tests. And if you think about how do we get an x-ray, some of that's chemical and some of it's physics, and how the beam is formed, where it's located, and how we actually can see the different layers, if you will, of the body via the x-ray. And then when you think of complementary or alternative therapies, such as veterinary medical manipulation, which is like chiropractic, only on animals, okay? It's very important to understand physics because you're using your body to relieve restrictions in joints. And so if you're not set up correctly, when that force that you apply on the animal comes back into you, because every force has an equal and opposite force, right? So if you're working on an animal and you don't have your body set correctly, you can actually harm yourself because that force reverberates back into your body. So all kinds of things that you have to think of that we don't necessarily think of every day that we're doing, but that the importance of knowing these basics applies to. It's not moving.
Uh-oh. Is it moving on your screen or not?
Nope.
Oh, okay.
Lost connection.
That could be bad. Hopefully we don't, sometimes we'll lose connection on there, but usually it'll go on the screen. My screen's gonna come up too. Yeah.
She looks like, except smaller.
Hopefully if you click on it, we'll if we have to do that every time, we'll figure it out.
That's fine. Alright, so anatomy. Like I was saying, this is one of the biggest areas of science that we use in my job. The biggest one would be physical examinations. So we have a poster up here if you guys would like to look at that a little bit later. But we'll see if Freedom will come up and do a little bit of an example of what we're looking for. So one of the first things that I do during my physical exam is I see how the patient walks. Okay? And so, does she walk normal? Is she limping? What do her muscles look like? And the other thing I'm looking for is her nerve function, right? Does she stagger around? Does she seem mentally appropriate? Okay, so Freedom is mentally appropriate. She doesn't seem like she's limping or overly sore on any legs. Okay? Here, babe.
Do you want to put her on the table? Or?
Sure.
Okay. Good. All right.
It's nice to have an assistant who does the heavy lifting for you.
There you go. Good girl.
Real Freedom.
Table breaks.
The children said,
Allie, I might need you to move, because
So what's the importance of
Good.
So if I'm starting from nose to tail,
yeah, that's
you
good.
look at the nose, right? You're looking for normal conformation. Is there normal airflow through both nostrils, right? Okay. And you're also looking in her mouth. And so you look for missing teeth. You look for gums that are pale instead of pink, ones that aren't moist. And then if you look at her eyes, you're looking for symmetry of her pupils. You look for discharge. You look for if one's squinty, right? So we're using our anatomy and what normal should look like to say something's abnormal. Good girl. For ears, now every dog has different ears, right? There's lots of different species. They all kind of look different. So you need to kind of know what the normal is for each different species in terms of what their ear flap looks like. And then also look kind of down in the ear. And we have tools that we use to actually look down into their ear canal. So we can look at the eardrum and look at the skin of the external ear canal and say there's redness, there's debris, things like that.
Don't wipe off the table.
Yes, you are. You're
She's a little nervous right now.
she might share more than
She's carpeting the table.
Yeah, we can
we're making it hard for the table now.
So one of the biggest things with anatomy that we learn, not only do we learn what things look like visually, but we also learn what they should feel like with our hands, right? Because there's a lot of things going on internally that I can't actually see. So if I feel up here behind her jaw, she has salivary glands and she has lymph nodes. And so I feel those, and by my feel, I can say one's bigger than the other, they're swollen, they're more pronounced. Same thing down here. There's lymph nodes right here, too, in front of her shoulders. So we really have to use our hands to feel those structures as well as feel her muscle mass. Is it symmetrical? Does she have a muscle that's maybe really weak? Okay, and then if so, which one is it, right? And then we use anatomy and we look at our bones and we say we should be able to feel certain prominences, just like we can on people, right? Like you can really feel your elbow and that kind of thing. So we should be able to feel those, certain parts of the scapula, the ribs, right? We should be able to feel those. So all of our anatomy is very important, and it's our biggest tool in how we figure out what's wrong with our pet. So Freedom, you look pretty healthy, sweetie. Yeah. All right. You want to come down, honey?
You got it?
Come
Yay!
He's so happy.
Feel free to just. It's like snowing right now.
It is.
All right, good girl.
So those are kind of the basics. And you go head to tail, right? So you look at the abdomen, we feel the abdomen. We look at the tail, we lift up all of the joints, feel all the joints, all those kinds of things, okay? The other thing that anatomy, of course, is really important for is surgery. Just like human doctors, we need to sometimes do surgical repairs on animals. We need to repair their ACL. We need to take out foreign material if your dog's ever eaten something they're not supposed to, and sometimes it gets stuck. That's what that surgery is. We also do sterilization procedures. So we spay or neuter pets so that they can't necessarily reproduce, and that way we help control our animal population as well. So it's important to know your anatomy because you don't want to be taking out something that you're not supposed to, right?
Yeah. There goes the liver.
Okay, well, no, that goes the heart. Alright. Reproduction is another big aspect. This is especially important for, I would say, more large animal. Okay, our dairy science, our dairy medicine, reproduction is very important, right? Because you can't get milk if the cows don't have babies. So we need to be able to know how the cycles work. So some biochemistry in that aspect, but also anatomy of when you're feeling, for babies, are they pregnant? Also when you're artificially inseminating the animals to get them pregnant. You need to know where you're going so that you can be successful in getting the animal pregnant. Radiology and ultrasonography, so those are two of our diagnostic methods, right? So x-rays and then using an ultrasound to look at the internal part of the body. And we always say you use your imaginoscope a little bit because you need to know your anatomy and it looks different than it would on a live animal in person, right? Because you're using these machines and these tools, and so you need to know what's kind of supposed to be where so that you can say, this part here doesn't look quite right. And that's how you can help decide what's going on with your pet and come up with a diagnosis. And then complementary, alternative, and integrative therapies. So this is becoming more and more important in the veterinary field. So acupuncture, our chiropractic, right, our veterinary medical manipulation. It's very important to know your anatomy because those are a lot of our points that we use to put in the acupuncture needles or to know how to relieve a restriction. Okay? Exactly.
Yeah, no dice. All right. You keep talking, I'll work on the next slide.
So microbiology, our biggest aspect that we use here is we look under the microscope at various samples. Okay, so an animal has a skin infection, they have an ear infection, even a urinary tract infection. How do we figure out what bacteria or what microorganism is causing that disease? We do that by looking under the microscope, by doing culture plates and growing the organism, and then looking under the microscope and analyzing it. Okay, we can also look under the microscope at various fungi organisms, so we can help determine which one we need to treat. Okay. Physiology. So that's basically, the normal functioning. So internal medicine, how kidneys work, how nerves work, neurology, right? How the heart works, cardiology. Those are all different branches of veterinary medicine, just like they are in human medicine. And you need to be able to know how everything works so you can say something's abnormal. You're hearing an abnormal heart rhythm. The owner isn't.
I don't know where you need to catch up to.
There we go. The pet isn't neurologically sound, right? They're not maybe walking normal, they're staggering because something's wrong with their nerves. So really all very important things that we need to know and that we use every day to be able to diagnose our pets with various problems and diseases. Alright, so our chemistry. So as we kind of talked about the pharmacology, knowing the different structures of the drugs and therefore how they interact with each other in order to make sure that we're not causing more problems for the animals instead of helping them, right? Because one of the biggest things is that we do no harm. That's our oath that we take as a veterinarian, similar to the oath that a human doctor would take for their patients, is you never want to do more harm. So we need to make sure we understand how our pharmacology works. In addition, when we're calculating drug dosages, we use a lot of maths. So that's also very important. And then the biochemistry, like we talked about, the big one is how does the body make energy? Okay. So physics, I touched on this a little bit earlier, but such as an X-ray beam, how does that work? What photons are, how do they get activated, and how does that beam go through the animal? And then veterinary medical manipulation is very important to make sure you're structured correctly so that you're not harming your body when you're trying to help the animal. All right. So I have a couple cases for you guys, and I would like you to kind of think about what I said and use your observation skills, which is an important science skill, and let me know kind of what you think. So when you see a picture of this cat, what kind of observations do you have? Yes?
It looks adorable.
It looks adorable. That's a good observation. Yes?
One eye looks different from the other.
One eye looks a little bit different? Which one do you think?
The right eye looks different from the left eye.
Okay.
So that's
pink nose, so likely that means she's good circulation in her body, right? Because if she didn't have enough blood in her body, those probably won't be pink. Anything else? She has legs. One thing I can tell you is that this is a female cat, and the reason I can tell you that is because only females, with the rare exception, are calico. So only females will have the white, black, and the orange, and that's based on genetics, because the color is on the XX, basically, chromosomes, and so if you have two XXs, you can potentially have all three colors, whereas if you're an XY, you can't end up with more than two. So unless it's a male that has XXY, which would then be a sterile male, it's going to be a female. All right, so this is a picture of her ear. What do you guys think? Mm-hmm.
It's like a brown.
Yep, there's a brown crusty part.
Can't hear much?
Probably can't hear much. All right. So yes, that's an abnormal ear. There's abnormal debris in the ear. So what different aspects of science do you think we have to use to treat and diagnose this ear? You could. Yep, you could do laser therapy to help with inflammation, right? Anything else? Okay. So one of the first things that we would do is clean out the ear, take a sample, and look under the microscope. And what do you think we're looking for under the microscope?
Bacteria.
Bacteria. Yep, because we want to make sure we're treating appropriately with the right medication. So we want to see what the bacteria look like. Is it just the normal skin bacteria that overgrew, or is it something completely different that we then need to treat with a different medication? Okay, so we're using our microbiology, right? We're also using our anatomy, looking at, we'll use our tool to look down in the ear canal and use our anatomy and say the eardrum's intact, or the canal's really swollen and inflamed and red, and that's not normal, right? And then we're also using pharmacology for the medications that we prescribe for the pet to help clear up the infection and also decrease the pain that she's experiencing. Okay? All right. So this is a little bit of a harder case. So I have a video for you guys, maybe, that'll play.
Is it the same one that you emailed me?
Yeah.
I have it in a folder.
Oh, that's a speaker. Oh, that makes sense.
Oh, I thought it
It's a microphone worm. It's a microbeetle. It's a microbeetle.
You have a pet? And if you pet it and you can use it.
Like a speaker called a microbeetle. It was really a beetle.
You talk to it and it repeats louder. Hi, my
With a brain. Flip open the head. So the brain, you had to press it down and say something. And then it would say it back in a different voice. It was so She likes pee better than So do we never have them ran Mondays? Maybe they're looking long. Right. Oh, you know
Okay, so this is a video, and I want you guys to watch it and then give me your observations and what you think could be wrong.
That's a kangaroo.
Okay, yes. Messed up hips?
Brother got like hit by something.
Maybe got hit by something?
It could have been rated like in a different way.
Okay, yep, some poor genetics. Yes, sir.
Could have been. It could just have both legs.
Got, maybe both of her legs are broken? Okay. What aspects of science are you guys using to determine that? Observation? What else? Maybe anatomy, right? Basic anatomy and how an animal should move. Right? So, this is a husky. She's a little over a year old. And it is her hips and her knees. So, good job. And she was born that way. So, she did not win the genetic lottery. Yep, and she ended up with basically some pretty rough knees and hips. Her knees are the primary problem at this time. Okay, what they do is her patellas, so her kneecap, actually pops out, and it doesn't stay in the groove of her bone here, and so that's why she can't straighten her legs and why she walks all crouched like that. Okay. Yep. They do have those, yes. She does not have one. Yeah, so, but yes, yep, you can use that for dogs that are paralyzed or even dogs with this, potentially with this condition. But the good news is, this condition is surgically somewhat fixable. Okay, yep.
So, are you going to get for surgery or she?
Yes, she had surgery. So, can I switch back?
Yeah, I may have to. Do you need to do the after video or?
Yeah, we can do the after video. So basically, well, while we're getting that figured out, I'll talk a little bit about the surgery that we're doing. So she had 2 surgeries on both knees, okay? So what we did is we deepened the patellar groove in the femur, okay? So basically it was too shallow, and that's part of the reason why her kneecap kept popping out. So we put her under anesthesia, we opened up her knee, and we actually removed a section of that bone and then put the patella back on it, okay? So it was deeper. The other thing we did is that her tibia, so the bone below the femur, right? It wasn't quite lined up correctly. And so because it wasn't lined up correctly, it was also causing that kneecap to come out. So we had to actually take a section of that bone and move it to its correct location and then put pins in it and wait for the bones to heal. So she had that surgery done on both legs. It was about a 6-hour surgery, and we had to actually go back in again and add another line because her patella actually then started going the other direction. So she required surgery. Yep.
Was it 6 hours for each leg?
No, it was 6 hours total. Yep. So 6 hours under anesthesia. So that includes, we put a trach tube down, there's tubes so that the animal is basically sleeping, right? And then we have to shave the legs and we have to sterilize the legs by putting iodine and alcohol around them. And then the surgical procedure itself. So that's an orthopedic surgery, right? So anatomy is very, very important because you're working in a small joint space and you're dealing with bones and ligaments and muscles more so than other areas. And we also worry a lot about infection in orthopedic surgery because we had to put pins, so metal rods basically, in her bone to help hold it in place while it healed. And those are also areas that bacteria like to sit on and can cause infection. Yes.
Major technical difficulties. Miss Young's drawing is in underground.
This is not Miss Young's room. Miss Young, you can't even start the video. It'll go black.
Yeah, how do you
What's the play?
I have the video up here, but it will not cast.
Lifted He's like in that side.
And the wall, like you said, was hideous, but really not. But it's not hideous.
So basically, Lincoln's dog.
What about my pussy trip? Oh, okay. Can you
Alright, you
So those two surgeries, right? They sound really complicated. It's important to use anatomy. This is what she looked like 2 days after surgery. Sorry. You don't need to hear our commentary.
She got her pants. She won't ever get to put her pants
Walking a lot better, right? So I'll play it again, and obviously besides the really great thing that she can walk now, right? Also observe what other things that you might be seeing that are a result of her surgery, if you will.
That's exactly what my dog looks like.
Yep.
Yeah, it's like it has fur. I don't
Exactly. And it's into the trash can.
Alright, so what other things did you guys see? Yep.
I'm assuming you guys had to shave her leg to like around her ankle area.
Yes, ma'am.
Her legs look a lot straighter and less bent. She's not as much.
Yep.
Her legs look stiff, but that might just be because she's walked crouched for a while.
Very
And
very
she's
true.
not used to walking normal.
Muscles definitely take real on her back legs.
Yes. So all of you guys are correct. So we had to shave for surgery, and she has very little muscle mass. This husky actually only weighs about 35 pounds.
Oh wow. That's not good.
So part of that is because she didn't have correct anatomy to be able to support normal muscle mass. So now that we have her walking, the goal is to put some weight on her, some muscle on her. Okay? And she walks stiff because she's not used to it, and also because she spends the first year of her life basically with those crouch knees, her ligaments and her tendons are really tight. So we basically are doing rehab exercises with her, we're doing acupuncture, we're doing laser to try to all promote her ligaments to gradually stretch out and start functioning normally again.
So, like, the owner, like, is the owner, like, at the vet, or, like, works for the vet, or?
Yeah, so the owner, they're very nice people, and they just weren't able to, they did one surgery on her previously, and it was unfortunately not successful. And so they were just having a really hard time having her as a pet because she couldn't walk. She needed to be carried everywhere. That's part of the reason that she had to be so light. And so they basically surrendered her to us at the vet clinic. And so we were able to perform the surgery and get her walking again. So she's currently the clinic's dog, and the goal is to hopefully rehome her. But yeah, so we fixed her knees, but somebody said hips before. She does still have hip problems. And so as she gets older, those will probably need to be addressed as well. Her hips basically kind of pop out of the socket every once in a while. Yeah. So just did not win the genetic lottery, but at least she can now walk. So the other thing, you guys maybe didn't notice it because you don't do this for a living, but she also has a lot of swelling around those knees, and actually on the inside of both knees, you can kind of see it in the video, there was kind of this huge ball, and basically that's fluid and serum from the surgery and swelling. And so we were icing her as well to help get that to go down and dissipate back into the body. So she's now been out of surgery about 6 weeks. We're going to be going back in a couple weeks here and taking out those pins. And then she basically should be good to go for a while.
Is she able to run now?
Yes, she does try to run. We have her on a leash so that she can't. She wants to. We don't want her to have that type of activity yet, but she loves to walk around and try to play with other dogs.
So it's
When she got out of surgery, did she get to like walk immediately, or was it like an amount of time?
So after she was awake, that night she was walking outside with help. So basically we had a towel under her belly so that we could help support her. So we had one person at her head with the collar and the leash, and then one person with a towel around her belly to help support her, but she could walk by that evening. And this is about 2 days post. Yeah. All right. So that is what I have for you guys today.
There's no more on the presentation.
The rest are
Okay.
pictures.
Okay.
Yeah. So what questions do you have for me about my job or science or anything like that?
When did you like figure out what age did you figure out that you were
Hey, hey.
So I figured out I wanted to be around in about 4th grade. I've always loved animals, and I never actually had one up until that school. But I've always loved animals and always wanted to be a vet. And so in 4th grade, you know, I don't know if you guys had this, but they had us fill out the what do you want to be when you grow up. And I went down, I wanted to be a veterinarian. So in 4th grade, I do. Any other questions for me?
Why did you decide to be a vet? That was just asked. I don't know.
No, so, I love animals, right? Most veterinarians do. And the biggest thing is I want to be able to help them because they can't speak to us and let us know their problems. So for me, that was a big drive, is these creatures, they're dependent on us in a lot of ways, and how can we help their life be full and healthy and help them when they're ill, especially because they can't tell us what's going on.
What is the most difficult part of your job?
The most difficult part is probably when a treatment is unsuccessful or an animal reaches the end of their life. So we have the privilege, if you will, and also the burden of being able to humanely euthanize a pet, which basically means when they're very old or very sick and nothing can be done anymore, the owner can make the decision to elect to euthanize, basically put the animal to sleep. And we have that is part of our job. It's a very sad part, but also, if you look at it the other way, it's something that we can do to help the animals have a peaceful passing. So that would be the hardest part, as well as if something's not going right with the treatment, or you're doing surgery, and it's not successful, then having to go out and tell that owner kind of what's going on, and that either euthanasia is the only option, or the pet died on the table. Yes.
What was the most difficult surgery you've ever done before?
So the most difficult surgery I've personally ever done would probably be an enucleation, which is basically the removal of an eye. So we had a little cat who was a shelter kitty, and she had trauma to her eye, and it needed to come out. And so that's the most difficult surgery I ever did. We have a different vet who does all of our orthopedic surgeries, and those aren't easy at all.
So what's the hardest, the surgery that you ever done?
That would be the enucleation. So there's lots of different surgeries out there. So I haven't done orthopedic surgeries yet. That's something that I'd like to learn, but that I don't know yet. So those are very difficult. Any surgery regarding the neural system is very difficult. So the neurology service specialists, like down at University of Wisconsin, they will actually do surgery on the spinal cord and that kind of thing. Yeah, so those are very difficult. You have to be very careful with those.
What's your favorite part about being a vet?
My favorite part is probably seeing how a pet can go, like this husky here, how a pet can go from very painful, not functioning correctly, to being able to be doing a lot better, have a greater quality of life. It's really rewarding to see that. Plus, it's always fun seeing the kittens and puppies as well.
How many owners invest in
Freedom.
Don't like that much either.
She thinks it's like the front door at home, and if someone walks by.
Mailman.
Guys, I have a question I need to hear. Yes, ma'am.
How many owners invest in pet insurance?
It's becoming more popular. I would say for the puppies that we've seen in the last like 6 months, maybe 40% invest in pet insurance. Most people get it as a puppy or within like a year or two of age. Otherwise, it kind of doesn't pay because they won't cover any pre-existing conditions. The weirdest case I've had. Probably one that I've had just the other day. It was a cat that was found kind of like on his side and drooling and unable to walk. And on physical examination, by the time they got to the clinic, he was mentally appropriate, he could walk, but you could see that he had drooled a lot. And we did a whole bunch of testing, and everything was relatively normal with the exception of elevated white blood cells, so he has some type of infection, and we don't quite know what it is. And so we're trying to figure out currently what's going on with him and trying to treat what we can. So that one's probably the most interesting one that I've had right now, is because I really have my diagnosis list basically is very, very long, and we're trying to narrow down exactly what the cause is. The funniest thing that's happened, puppies are pretty comical. They trip over themselves a lot, fall over their feet and fall off. I have an ottoman in my exam room and they fall off that a lot, so that's pretty funny.
What was the longest surgery?
The longest surgery I've ever done has probably only been about 4 hours. That was a dental a couple weeks ago. Yeah, we're taking out some teeth on the dog.
You guys complain about a 47-minute test.
Yeah, so, but definitely the orthopedics get really long for Dr. White.
What does pet insurance do?
So pet insurance it's similar to human health insurance, where it helps pay for any expenses for any illnesses. Some of them cover basic health, a lot of them don't. So a lot of the yearly annual examination, just like how you should go to your doctor every year for just a normal health check, right, and any vaccines, those usually aren't covered. Kind of depends on the company, but basically if your dog or your cat eats something that they're not supposed to and you have to go into surgery to remove it, if your dog tears a CCL, so an ACL in a human, all those surgeries then would be covered under pet insurance, and so you only have to pay a fraction of that, so it helps a lot with costs.
How many hours a week do you work?
It depends. It depends where you work. It depends if you're doing small animal or a large animal. I currently put in about 50 hours a week.
Wow.
4 days a week. And that's just my yeah. So that's just my small animal work. For my horse work that I do on my own, that's dependent of another 5 to 10 depending on the time of year. If you're in a clinic that does emergency work, your hours might be more or more sporadic, meaning you have to be on call for when people have an emergency at 2 in the morning, they can call you and you have to get up and go. And if you do any large animal work, cows and everything like that, you also have emergency hours.
Have you ever got like bit, wrapped, cut?
Yes, ma'am. I guess I don't currently have a lot right now, but yep. Almost got bit by a dog on the nose the other day. That's never exciting. So you use your staff a lot. I have some really great technicians, veterinary technicians that help restrain the animals for me, and their job is basically that I don't get bit. So we do end up with scratches, we do end up with bites, but we do our best to make the animals comfortable so that they're not fearful. And if they are very fearful and scared, we'll sometimes use a nose warmer, or basically a muzzle, to help prevent them from doing harm to themselves and harm to us.
What's the most popular surgery at the clinic? Like the one that's been performed the most?
Spades and neuters. So basically sterilizing our pets so they can't reproduce. Yeah, we do those the most often.
How long did you go to school for?
So I did 4 years of undergraduate, so I had my bachelor in science and animal science, and then 4 years of vet school. So basically a minimum of 7 to 8 years. You don't have to get your bachelor degree, you have to just finish up a certain amount of classes. But I decided to get my bachelor degree as well, and then if you want to specialize, if you want to become a cardiologist, that's another 4 years.
What's your favorite animal to treat?
My favorite animal to treat.
Freedom's not in here, so if it's something
No.
other than a dog.
Well, they all have their pluses and minuses. I would say horses are somewhat of my passion, but I also do, I do mostly just alternative therapies on horses, which I really enjoy. That's kind of my fun. That's why I do that on my day off. So,
One last question.
So I want to use that vet. Do they have to look the exact same schooling, or is it different schooling?
for who?
Exact vet.
Same exact schooling, but then they have to do an additional 4 years.
All right, so what do we say to Miss Tyson, Dr. Tyson?